Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is 5 things to know about epidural steroid injections. Epidural injections were first performed back in the 1950s, so they have a 60-year track record of use in pain management. The purpose is to relieve the pain from pinched nerves in the spine, and they're most commonly performed with cortisone as the steroid. First thing to know is the indications for the injections. One would be a herniated disc with sciatica. That's the most common, where you have a disc herniation here that's pushing on a nerve root. A second one would be spinal stenosis, which occurs from degenerative arthritis in people as they get typically older, where you have overgrowth of soft tissue and bone, and then you start pinching on multiple nerve roots. The other one will be degenerative disc disease with irritated nerve roots, where you actually don't have a herniated disc. You just have some tears in a degenerative disc. That can spark up inflammation in the area and cause sciatica. Second thing to know is how they actually work. Cortisone is a very large anti-inflammatory medication. So it doesn't cure the situation, it doesn't fix the spinal stenosis or the herniated disc, but it can work well for pain relief as a proverbial Band-Aid. And typically they stick around for weeks to months, and then slowly it dissolves the medication away. Third thing to know is that there are 3 different types of epidural steroid injections. There's an interlaminar, transforaminal, and caudal epidural injections. So interlaminar is the traditional type that was first invented, 50, 60 years ago, where you have a needle going between the lamina, you have a lamina and a lamina, and it goes through the soft tissues here, and then the steroid medication is introduced. A lot of these were performed without fluoroscopy or image guidance, so it really was unclear whether the medication was actually going to the appropriate place. Now these are done under image guidance, either ultrasound or fluoroscopy. Here's a transforaminal injection. It's actually not put into the back there, it's sort of off to the side. Where the spinal nerve root gets out is called the foramina. Okay? So the needle goes transforaminal, and it gets closer to the area where the herniated disc is pushing on the nerve root. So it really puts the medication where it's needed and bathes that inflamed nerve root with soothing medication. Third type is a caudal epidural. This is very different. The medication goes at the very bottom of the sacrum through this little hole here called the sacral hiatus. The medication is injected in a larger quantity, and then it sort of migrates upward, and it can actually relieve pain from multiple nerve roots being pinched from something like spinal stenosis. So fourth thing to know is the outcomes. Dozens of studies in the past couple decades have looked at epidural injections. Overall, 3/4 of patients receive good to excellent outcomes. Some studies show 50%, some studies show 90%. You average them all together, and you get 75%. Studies should include randomization and the use of X-ray guidance. If they don't include X-ray guidance or some kind of ultrasound guidance, then those should be discounted. A prospective study of patients with radicular pain, meaning pain caused by a pinched nerve root, caused by degenerative lumbar spinal stenosis, found that after transforaminal injections, 3/4 of patients had at least 50% reduction in pain, 64% improved walking tolerance, and 57% had improved standing tolerance. So multiple outcomes were improved for spinal stenosis. The fifth thing to note is that these are not FDA approved or denied. They're used off-label, just like 40% of medicines in this country. There are a lot of treatments out that work very well for indications that they were not initially approved. So just to go back, there's a few medications like Neurontin. Neurontin's not approved for neurogenic pain, spinal stenosis, or things like that, but it's used all the time by physicians across the country. So it's not a bad thing that it's not FDA approved. I just wanted to point that out. The bottom line is that epidural steroid injections are very effective treatments for pinched nerve conditions. They're outpatient, they're low complications, less than 1%, and they may be repeated as a series, 3 injections over a period of 6 weeks, and that can be repeated every few months. The top non-operative pain management in Washington is through the Washington Pain Network. Over 50 insurances are accepted with over 25 treatments being provided. There's over 90% overall success rates on average with the board-certified award-winning providers. Visit us online at WashingtonPainNetwork.com or call us at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.